What does health insurance usually cover in New Zealand? Well, the core of most of the major plans is surgical, that being in a private hospital, drug treatment, so covering you for drugs that aren't funded by the New Zealand government. That's a huge thing, actually. Sidebar on this, you have cancer in New Zealand, you have certain drugs that are subsidised by the government, and that is your treatment plan. That is what you can have access to unless you pony up your own cash to pay for the drug treatment. Now, most of the insurers have clauses in their contracts which are to cover you for non-pharmac subsidised drugs, which mean it opens up, basically it opens up you up to world-class treatment and leading-edge treatment should you suffer, say, a cancer or another serious condition. So that is where, in my view, that is where medical insurance really comes into its own. So what does it usually cover? Major surgery, drug funding, private hospital stays, specialists and tests. So you go to your doctor, the doctor says, hey, you got to go to the specialist and get your nose looked at. It'll cover you for things like that. For children, it's things, adenoids, children get good care in New Zealand, but the wait lists can be long, so it gives you the option to skip that wait list as well. I get asked a lot, you can add things like GP cover, you can add things like dental cover, you can add things like optical cover. Those are all additional add-ons to your policy. If that suits your needs, then hey, you can absolutely look at exploring those options. But the key thing that medical insurance covers you for is that surgery treatment, is that specialist treatment, is that drug treatment as well, with the ability to skip the queues and go into private care.